Hi, I'm Dr. Singhania from Singhania Clinic, and I'm going to talk about obsessive compulsive disorder. So what is OCD? It is a neurobehavioral disorder and it causes irrational and excessive worrying or superstitious beliefs that makes the person feel anxious, worried and negative, and so they do things to make it feel better through compulsive actions. It's important to remember it is an illness, a medical problem, and it's not under your child's control. So it's important to understand the obsession and compulsion cycle. So there are these irrational thoughts in the brain. It's as if the brain has got a glitch and it's stuck on this irrational fear, maybe say of germs, and everything feels germy and contaminated, and this gives rise to an obsession is a feeling, a thought or a belief, and this gives rise to anxiety, worry, unease, and the only way the child can reduce that anxiety is by doing compulsive actions. So fear of germs may result in repeated washing to the extent that hands get chapped and red. It could be also other obsessions like fear of harm to self or others. I had a child 11 years old who came in because he had this irrational fear of killing his mother and his baby brother. So his mother had brought him into the clinic because he had these very distressing thoughts. There could be other forbidden thoughts, often of sexual nature or morality. There are needs to tell and confess. So what are the compulsions? The compulsions are repeated washing, repeated checking to see if they've closed the door, counting, they need to do something in threes or fours, or hopping from one tile to another. It may also be excessive praying, constantly confessing, or hoarding things. OCD is seen in well-defined OCD is 1 in 200 children. So in a school, there may be at least 3 or 4 kids who have OCD. And OCD has a very strong genetic component because it is a glitch in the brain. It is often triggered by stress, but it is not caused by stress. The abnormalities are in the circuiting of the brain. There are especially within the limbic and the prefrontal cortex. Serotonin has been implicated, and sometimes, interestingly, some children begin to exhibit these symptoms after a severe infection. This is known as pandas, and a child has a strep throat. Strep is a common bacteria which can affect the throat, and after strep tonsillitis, the child can develop OCD-like behaviors. There was a young girl, I remember, who had a fungal infection, and she was a lovely outgoing person, but she suddenly became very shy, withdrawn, and she had these obsessions and compulsive behaviors. But after treating her fungal infection, she improved dramatically. It's very stressful for the child who has OCD. They feel frustrated and depressed because they can't resist the compulsive action. Because if they do, they feel very anxious. And often this is seen as bad behavior, and they get either ridiculed or reprimanded or scolded for no reason. Often OCD is associated with things like ADHD and learning disorders, bipolar or mood disorders, tic or Tourette's disorders. This is when the child cannot control the movements of his body, has tics, and also has associated ADHD. If you're seeking help, please visit our website www.singhaniaclinic.com or call us on the number shown below. Thank you for watching.